Dr. Nathan, thank you so much for joining me today. I really appreciate you taking the time out of your busy schedule to shed some light on mold-related illness.
Thanks for having me.
I'd like to know, y- you're a medical doctor. What got you into this field around mold? Was it patients? Did you have a mold background story yourself?
I didn't. A lot of the physicians who get into this field have themselves or a family member sick, and they kind of realize it's something they need to wrap their head around. Um, I I think the start of my story is um, for many years I've been a pain specialist, and in the middle 80s we started seeing an odd condition which we called then fibrositis. Now it's called fibromyalgia, and it didn't look like anything we'd ever seen before. And since I was at the time a pain specialist, what most people do with something new is decide that it's psychological until proven otherwise. But people got all kinds of medications and they got psychotherapy, and it didn't help them one bit. So it was clear that it was not a psychological illness. It was a physical illness, and we didn't know the pieces. Over the next couple of decades, we began to learn that it was related to hormonal imbalance, magnesium deficiency, gut dysbiosis, food allergy, and then we began to realize that Lyme disease and later mold toxicity were major players in what was causing fibromyalgia and chronic fatigue syndrome. So I came in that door in which when we first started learning about this, for me, in 2005, I had a patient who came into my office and plopped uh, Richie Shoemaker's book, Mold Warriors, which had just come out, on my desk and said, I want you to read this. I said, great. I put it up on my desk with a bunches of other books. I have a stack of books. She said, no, you don't understand. I want you to read this right now. So I said, great. You're going to pay me for reading a book? Fabulous. This is a wonderful job. Fortunately, early on in the book, Dr. Shoemaker had laid out what he called the biotoxin pathway, which was a brilliant understanding of how mold toxicity triggered all of these disparate symptoms, and he put it together in a package that I really understood. And so literally, I went out to where he lives in Pocomoke, Maryland, and spent a week with him and studied with him and realized this is a big deal. We're missing something here. I immediately had, I was dealing with a lot of chronic fatigue and fibromyalgia and people who had all kinds of symptoms that my colleagues couldn't figure out. And all of a sudden, we had a way to diagnose it and treat it that not only made sense, we were able to help countless patients who had been languishing with no diagnosis and no clear treatment plan. And now we could. And that evolved. From Dr. Shoemaker's work, we worked together for a while, and then we have different approaches now. I felt like we needed to incorporate more and more of the research that was being done and the information that we were acquiring and create the most comprehensive treatment program possible. That's kind of what I feel like I've been doing. So that's kind of how I got here. And now we're able to help many of the literally millions of people in this country who are suffering with mold toxicity.
So millions. What would you say in your estimation or in the research's estimation is the scope of mold-related illness? Like what kind of numbers are we talking?
Uh,
Households, people?
most people are talking 10 million Americans right at this minute have mold toxicity, and most are not aware of it and they've never heard of it.
And so how would those patients manifest? You mentioned fibromyalgia earlier, but are there common clusters beyond that that you see clinically in these people?
Sure, there are. Um, any condition that a specialist diagnoses as atypical, what we'll often see, people will be told they have atypical rheumatoid arthritis, or atypical multiple sclerosis, or atypical Alzheimer's, or atypical Parkinson's disease. Whenever you hear the word atypical, almost always that means it looks a little like that, so that the specialist isn't comfortable saying, yes, it is. These are almost always either mold toxicity or Lyme disease.
Okay. So atypical is the kind of the buzzword that the patient needs to kind of,
It's a word. As I mentioned, chronic fatigue and fibromyalgia. Dr. Joe Brewer did a study 2013 where he took 112 patients with chronic fatigue and fibromyalgia, and he discovered that 92% of them had mold toxicity. And in proof of that, when he treated them, the vast majority got well. So we're talking about an illness that other medical people say is not treatable. We don't have a cure for it. And actually, we do know what's causing it in many patients, and we can cure it. Um, Patients who've been told that they had asthma, but they're not responding to the normal treatments, will often have mold toxicity. Neurodegenerative diseases, again, Alzheimer's, Parkinson's, ALS, are often a manifestation of mold toxicity, unusual neurological ways of presenting. Children on the autism spectrum, many of them have mold toxicity. So it's kind of what we call a great masquerader. It has so many different ways of manifesting in the body that if you're not familiar with it, you might look at someone and go, nobody could have that many symptoms. But the symptoms are caused by inflammation triggered by mold toxins. And that inflammation is systemic, it's global. And so wherever someone has a weak system, biochemically or genetically, it's going to manifest as a form of inflammation. And so neurologically, it can manifest, as we said, with Alzheimer's or Parkinson's. It can manifest as a peripheral neuropathy. In the lung area, it could manifest as asthma, shortness of breath, chest pain. Cardiovascularly, we'll see palpitations and arrhythmia. In the GI tract, almost any GI symptom can be a manifestation. Gas, bloating, distension, diarrhea, constipation, abdominal pain, reflux. Um, and global symptoms, fatigue, cognitive impairment are big. For example, Dale Bredesen has been doing groundbreaking work in showing that Alzheimer's disease is an inflammatory process that affects the brain. If you can figure out what parts of inflammation are doing it, you can actually cure or markedly improve people with Alzheimer's disease. And one of his findings is that mold toxicity is present in most of them. So again, very often missed in that situation.
I mean, that sounds really rather alarming because you mentioned a lot of the conditions you just mentioned are quite prevalent. And
Oh, yeah, absolutely. Psychological conditions, very, very common in mold toxicity, anxiety, panic, depression, depersonalization, derealization, obsessive compulsive disorder, very, very common. So almost any symptom you can think of is being triggered by the inflammation triggered by mold toxicity. And I don't want this to be alarming, rather empowering, in that if someone has a lot of symptoms that have not been explained by going to your family doctor or internist or wherever you're going to see, and they're basically scratching their head and saying, I don't know what could be doing this, then basically mold toxicity and Lyme disease are the two most common conditions that are being missed.